How do you approach treating chronic pain sufferers?
When a new patient comes to my office, the most important thing is that I listen to the patient. Listening to the patient is kind of 90% of the understanding what is going to happen onward. So, listening to the patient fully, compassionately, and with a presence of mind, that's the most important thing. And then I want to examine the person thoroughly. Not just that area which is causing the pain, but as a whole, the whole patient. Because we don't treat just lumbar spine or neck or the shoulders. We are treating the person. So this is like the most important part of my interaction with the person. I do some imaging studies, MRIs, electrodiagnostic studies, and all those things I prescribe. However, that is to establish the diagnosis or to impact my treatment plan, what specific things I'm going to do later on. So those labs and imaging and other tests are just meant for planning the treatment for later on.
What's the most important modality you use in diagnosis?
In terms of diagnosis, is to identify the pain generators, the structure that is originating the pain, and then the secondary effect and what impairments it leading to. So that's the most important part.
With the organic movement and people not wanting to use chemicals, what are some of the non-pharmacological treatments you use?
I think the most important thing is that we should maximize these non-pharmacological areas of treatment. For example, understanding the mechanical default, the postural problems, the weak areas in the joints, that the joints are acting in an imbalanced way. And so people send these patients, refer these patients to physical therapists, chiropractors. However, those things sometimes are not maximized. And my role as a pain physician is to make sure that before we move to the medicine, drugs, opioids, and we know that so many side effects have been coming along the people. Right now there is an epidemic of narcotics. That's perhaps too much of irresponsibility in terms of prescribing and seeking narcotics, and then too much of surgeries. So we have to, before we go to that line, we have to really understand the mechanics, make sure that the patient understands the mechanics, and guide them towards that line.
I've heard you say this before, and I'm very interested in the difference between pain and suffering.
Yes, I mean, the pain is basically a normal physiological process, basically a nerve which finds something injured is going to carry the message of that injury to the brain. Now, the suffering, basically the suffering is our own brainchild. So we may not have control over the pain process, but we do have control over suffering. We can completely control or kind of manage and mitigate the suffering part. Now, as far as the pain process is concerned, I tell my patients that, look, this is a normal physiological process. Basically, if you are feeling more pain, that means your nerves are being efficient in doing what they are supposed to do. They are carrying the message to the brain. If we get a nail in our hand, immediately we are going to put that out, because the nerves carried the message to my brain in a hundredth of a second, and my hand did the action. So now those nerves, they have become hypersensitive. There are 10 points along the site of the injury to the brain where these messages can be modified, modulated, amplified, or even dumped down. And that's very interesting, those 10 sites. Before the neurosciences understood these 10 sites, and somebody comes with pain and we couldn't understand it, we thought that it's in their mind. We might be sending them to a psychiatrist. But now we know that there are so many areas in the brain that can be modulated. And maybe a person with the same injury and another person with the same injury, they are presenting different pain and different suffering. So understanding these 10 points is very important, and how we act upon them, how we modulate them. Unfortunately, most of the pain physicians, as well as the people who are taking care of those pains, they are focusing on the first part of the pain. So the knee is injured, so we are going to do the knee surgery. We are going to do something with the knee. And the back is injured, we are going to do something with back. What about the rest of the 9 points? And interestingly, and that's something which most of the people have to really understand, that when this pain signal gets into the body, before it is perceived, it lands on the emotional centers. As a matter of fact, the emotional center packages it and presents it to the perception part of the brain, because it wants to make it unpleasant. Because then you are going to do something. If this message is pleasant, you won't worry. As a matter of fact, those people who are born without pain receptors, they don't have the sensation of pain, they don't survive that much. So that emotional center actually kind of presents it to the perception of the brain. And see, that's where the suffering is. So it's not just simple physicality of pain, it is beyond that. And perhaps now you understand why I call that treating chronic pain is really a spiritual experience.